This is a retrospective study looking at the effect of using a cryopreserved amniotic membrane after Epi-Off cross-linking in keratoconus patients. Epi-Off cross-linking is a safe and successful procedure to halt the progression of keratoconus and has been FDA approved in the United States since 2016. There are some downsides to Epi-Off, however. Recovery is painful as we create a large abrasion on the patient's cornea, and this loss of the physical barrier increases the risk of infection. Patients undergoing cross-linking for progressive keratoconus are typically young adults, thus likely to be working or in school or raising a family, so any adjunctive treatment that could enhance recovery and reduce the risk of complications would be advantageous for this cohort. Procera is a cryopreserved amniotic membrane that promotes wound healing. It's derived from the innermost layer of placenta tissue and possesses anti-inflammatory and anti-scarring properties. Amniotic membrane is used to treat many ocular surface conditions, so I wanted to know if using it after cross-linking could improve our results. All patients underwent cross-linking following the Dresden protocol. The control group consisted of patients who were treated with a bandage contact lens. The treatment group had a Procera slim membrane placed on their eye after surgery. Vision initially worsened for all patients, then stabilized and improved, with a statistically significant difference at 6 months. Patients who were treated with Procera saw approximately 1 line better compared to the control group. Topography also initially worsened after surgery before stabilizing and improving. However, there was no statistically significant difference between the groups at any time point. At 1 week, slightly more of the control group had total epithelial healing, although this difference was not statistically significant, with the majority of patients healing within the week. There were 3 eyes with a complication in the BCL group, 1 each of an infiltrative keratitis, a persistent epithelial defect, and an infectious keratitis. There were no complications in the Procera group, and the 3 patients with a complication in the BCL group all underwent surgery in their fellow eye with a Procera and healed without incident. So cross-linking really represented a major leap forward in our arsenal to treat keratoconus. We now have the ability to stabilize the cone, reduce the progression to apical scarring, and thus the need for more invasive procedures such as a keratoplasty. In conclusion, Procera was well tolerated. It may reduce the risk of post-op complications and may improve visual recovery. So this study provides real-world clinical data relevant to physicians performing Epi-Off cross-linking and to optometrists co-managing surgical care.